I like to use an analogy for patients when they first come in to talk about the venous insufficiency issue. And what I do is I normally talk about grass. Most people can understand about growing grass. So peripheral arterial disease is actually the sprinkler system. So that's the blood going down to your feet, and that's where people get really nervous about having. Diabetics get that a lot. That causes ulcers also, and that leads to amputation sometimes. But sometimes people just can't drain the legs as well, and that's what venous insufficiency is. So it's more of a drainage problem, and the legs tend to swell. They tend to get varicose veins. They can also get ulcers from that, but it's a big difference between the two processes there. Either one needs to be treated, but at the same time, we like to lead in with that to kind of let them understand how that disease process works. Venous insufficiency can affect anybody at any age, but obviously the older you get, the more likely that occurs. Women who've had children, obviously that puts a lot of pressure on the lower extremities, on their vena cava, which pushes, that's the main vein in your body. It kind of pushes pressure down in the legs, and so you'll hear women develop varicose veins after pregnancy. But it can affect you at any time in your life. One of the first things people are going to come to us a lot of times and say is, I've got these veins in my legs that I can see. A spider vein means nothing more than the size of the vein. So if you've got these little blue, stringy looking spider web-like veins, that's what a spider vein is. A varicose vein is just the same kind of thing, except it's just a larger, more ropey kind of vein that you see in your leg. So the distinction is really about size. They're both a sign of a bigger problem sometimes. So the obvious things are like we just talked about. Sometimes you'll see people with spider veins, they'll have varicose veins, and they'll come to you and say, look at these, I don't like the way these look. They'll look down at their legs and say they have this brawny, brownish looking hue to their skin, and they say, I don't like this. Swelling is a big one where you'll hear people say, this is pretty obvious that I'm having swelling. And again, that analogy of the grass, having water standing on it, the blood is not draining from the legs, so it swells. Less likely what they'll tell you about, but when you kind of get their interest in it, you say, look, do your legs hurt at night? Do your legs cramp when you walk? Do you wake up with itchy legs? Do you have things like dry skin in that area where it doesn't want to go away and you flakes off a lot and you feel like you're going to lose your skin almost, where you're going to develop an ulcer there? Number one treatment for venous insufficiency always is going to be compression hose, and we do a very good job here of kind of identifying those patients up front and saying, listen, this is going to be a lifelong process. This is not something that just goes away. Even if we fix you, you're going to continue to have problems with this down the road. So you need to get people on board with a compression hose immediately, and we do a very good job of getting people the right prescription for the right compression hose and tell them to start wearing those, because eventually, even if we do some kind of treatment, they're going to have to get used to doing that, because that's going to be a lifelong process for them. So beyond the compression hose, that's when we move up the ladder, as we start doing something more along the lines of an intervention. So if we find a bad vein in your leg, specifically the saphenous vein, which you can read about, a lot of times what we'll do is we'll try to get rid of that vein. Back in the day, a lot of people remember hearing about vein stripping, and vein stripping used to be where they would actually cut you down the leg, and they would actually strip the vein out of your leg, and they would have to sew those incisions back up, and that was a pretty painful process, as you can imagine. Well, technology has caught up with that. Nowadays we can do a vein ablation, and it's basically vein stripping without having to do any cutting. We can actually go through a needle and have a nice little sheath in the leg down low, put a catheter inside that vein, numb the leg up, and turn that catheter on. It'll actually ablate that vein, and you'll walk out of the office with a wrapped up leg and a hole no bigger than a pinhead in your skin. I think if there's any question about legs, you should always run it by your doctor and let us do an evaluation, because it's hard for somebody to know what's important and what's not. If there's an issue there, even if you don't think it's bothering you that bad, let us check it out, because sometimes when we're doing these evaluations, we're not looking for, like I said, just the venous disease, but we're looking for the arterial disease also.